Bring your client support.
So we have completed this one.
Yes. Okay. So just to recap, under this we have monitoring the plan allows timely changes to be made and help to ensure whether the objective of support plan are achieved. So when you are dealing with your client or with your patient, okay, every time that you have encountered, or every time you are giving the nursing care, okay, you always formulate your goal. Okay, for example, if your resident is having difficulty of breathing, you need to come up with your nursing diagnosis, and after the nursing diagnosis, you need to create a plan of care. Okay, that after 8 hours of delivering nursing intervention, the patient will be able to breathe properly, okay, and be able to verbalize that she or he is having a normal breathing. Okay, so after 8 hours, you need to evaluate whether your nursing intervention has become successful or you did not success. And then if you did not success, you need to think another care plan for your resident or for your patient to give the proper nursing intervention to alleviate the suffering of your patient. Okay, that is the essence of the objective support plan are achieved. Are you delivering the good and relevant nursing intervention to your patient based on your patient needs? Can you please, are you okay?
Yeah, kinda.
Okay, so you need to think if you are giving the correct or relevant nursing intervention to your patient or not. Because when you give the nursing intervention to your patient, it is your sole responsibility and accountability. Okay? Before giving the nursing intervention to your patient, you need to think, am I giving the right and appropriate nursing intervention to my patient? It is really my patient needs. Use your critical analysis and your critical thinking for you to be able to give and deliver nursing intervention that suits to the need of your patient. Okay, and then you need to evaluate. Did your intervention be successful, or you need to come up with another nursing intervention to ensure that your patient will be having or will be verbalizing the lesson of their pain, or if they are having pain. Okay, or if as I have mentioned a while ago, if your patient having difficulty of breathing, and then you need to come up with a good nursing intervention, then come. But you are already late. Okay? I know, class, that some of you are living in a very far away place.
Yeah.
Okay? I know. That is why I'm giving you 30 minutes duration for you to be able to come to my class before 9 o'clock. Because I already told you last week that I will be giving my lecture at exactly 9 o'clock. And I will be checking your attendance at exactly 9 o'clock. Next is fine. But next time, make sure that you will be here before 9 o'clock. Okay? I'm easily disturbed when someone will murmuring and someone will open the door when I am giving the lecture. Okay? My thoughts is already as blown in the wind every time I'm distracted. Okay? So as I have mentioned, you need to evaluate if your nursing intervention has been successful or not. Okay? You know that because you already been working in the hospital. So when you give the nursing intervention, you always formulate the goal. after 8 hours, my patient will be able to verbalize the decrease of pain from 9 to 6. And then you need, after 8 hours, you need to reassess again the patient. So how's the pain going? Is it, are you having, is it lessened or is still the same as like before? Okay, if the patient will tell you it's fine now, the pain is less at the moment. So from the scale of 1 to 10, which is 10 is the highest pain, where is the pain now? Okay. When I came here a while ago, you told me that the pain is number 8 or number 9. Now, where is the pain now? In the scale of 1 to 10. And then if the patient will tell you, the pain is in scale of 5, then your nursing intervention is become successful. However, if there's no changes, okay, it means that your nursing intervention is not effective to your patient. And you need to come up with another intervention that will lessen the pain of your patient. Okay, question?
No, sir.
Okay, consulting with the client and their caregivers is one way to review your work. There are other methods includes observation. So when your patient will tell you, I am having pain. So for you to be able to assess that your patient is telling the truth and having pain, when they tell you that this scale of 1 to 10, 8, what are the necessary assessment that you need to assess from your client? Okay, I am your patient and I'm already telling you I am having pain. So you will ask me from the scale of 1 to 10, where is the pain? Is it number 5, number 7, or number 8? So if the patient will tell you, I am having number 8 in the scale of 10. So it means that the patient is having a severe pain. So what are the things that you need to assess for you to be able to get the accuracy of the number 8 pain as what your patient told you?
Like first of all, we should see the what kind of pain. Is it like pinching or pricking, and second of all, we have to see the facial expression of the patient or a client, because if the pain is at the number 8, then the facial expression would be a bit sad or like painful. So
Okay, yeah. So you need to ask what kind of pain. Is it pinching, stabbing, or squeezing? Okay? And next, when the patient tells you, I am having, it's like a stabbing pain. Okay? Then the patient already told you it's number 8. So she or he is having severe pain. So the next that you need to assess is the facial expression of your patient. If the patient is having facial grimacing during the time that he is telling you that I am having pain, or the face is just normal.
because sometimes like patient has what to tell, false pain. Patient thinks that they are having pain, but like it,
Just psychosomatic pain.
Yes, yes. I forget exact word.
It's psychosomatic pain. So if you need to assess, especially for those patients who are prolonged taking of pain reliever.
Yeah.
Okay? For those patients having taken the morphine, so some of them will become dependent on that medication.
Yeah.
And when they become dependent, those drugs are controlled drugs, that it's only be given to the patient with the doctor's prescription. Okay? It's not like a Panadol that you can give the Panadol anytime. Okay? Every 4 hours or every 6 hours. However, the morphine is only given with the doctor's prescription. If the patient can no longer tolerate the pain, then the morphine is given. However, the side effect of morphine is that patient become dependent on that medication. Okay? When the patient become dependent, they become addictive. When they become addictive, they keep on asking and keep on pretending that they are in pain so that the nurse will give the morphine. Or give the pain reliever. And for the nurse that giving that medication, you need to assess the patient carefully. Okay? Is the patient having facial grimacing? Well, he or she's telling you that they are having pain or not. Okay? If the patient is smart, the nurse must be more smarter to your patient, because you are the one giving the medication to your patient. You need to assess more, you need to assess deeply for you to be able to get the accuracy of the patient complaint.
Excuse me, sir.
Yes.
Like if the patient or a client have a liver disease or like any kind of liver disease,
Yes.
and then the Panadol is contraindicated in those conditions. For that time, what would be the like next option? Because like we can't give morphine to every patient because it has lots of like side effect. We can't give without the prescription of doctor. So
Yes.
what would the next option in Panadol if he or she have like liver disease?
So for that case, the doctor will be the one to prescribe.
Ah,
If that is the role of the nurses. Even though you are giving or administering medication to your patient, you have the full knowledge, the side effects of the medication that you are giving. Okay? If you think that this medication is contraindicated for another disease of your patient, then you will inform the doctor. Doctor, this medication is contraindicated to what he has having disease at the moment. Okay? So you can tell to the doctor that I am not comfortable of giving it because this is contraindicated for this disease. Do you have any option for this medication? So as a nurse, you need to use your common sense every time you are giving your medication.
yeah. Because randomly we can't give any medicine to clients because it may have source or more side effect to them.
Yes. So, do you have a meeting at the back? What is your agenda? Would you like to share to the class? What's the problem? Okay? Observation, as I have said, you need to observe the patient. The result of the assessment and discussion and consultation. So you already assess the patient and you need to give your assessment because most of the doctors rely on what we have gathered to our patient. Okay? You can gain high respect with the doctor if you are a good and smart nurse. Because most of them, especially if you are working in the emergency room, you know that how the patient come and go.
Yeah.
Okay? And if you are assessing the patient who brought to the emergency room, most of the time the doctors depend on what we have gathered. Okay? You can gain high respect with the doctors if you are smart. Okay? But if you are a bit stupid or slow nurse, even to the patient, to the resident, okay, they know exactly if the nurse are doing the right thing or not. So if they think and if they observe that this nurse are doing exactly what she needs to do, okay, then you can get high respect and get cooperation coming from your patient. However, if the patient or the resident in the nursing home will observe, oh, this nurse is really don't know what she or he is doing, then you cannot gain respect from them. And once you enter to the room, they will tell you, go away. I don't need you here. And then they will call straight away to the chief nurse or care manager to tell them that I don't like this nurse because this nurse doesn't know what he is doing. Okay? So once you talk to your resident, the moment that you enter to the room, make sure that you are competent or confident on what you are doing. Okay? Because they will ask you, how long you been working in this kind of job? Okay? So it's up to you how to deal with them. Be confident. Make sure that you know what you are doing. That is the reason why I'm telling you always that you need to read the chart of your patient or your resident before engaging your care with them. Okay? Because if you know the chart, if you read the chart of your patient, you know exactly what is your patient needs. If you attended the handover, is it handover you call it to your country?
Handover.
Because my country, we call it endorsement. So if you attended the handover, you know exactly what transpired during the time that you are not yet come. And then when you look after that patient or that resident, you know exactly what you need to do to them. Okay? And once you engage your care to your patient, make sure that you are confident enough to do what is necessary for your resident. Okay, next. Understanding the cultural needs of the client. Differences in culture can mean different expectations from you as a worker. You should learn about their culture and some important words of client's language to communicate with client effectively. Okay, when I'm still working in the nursing home, as I have mentioned, most of our clients and residents are Italian. You know, when they become demented, they only remember the first language that they have learned when they are still in Italy, even though they already been in Australia for 60 years, 70 years. Okay? They can no longer speak English because once they become demented, most of them, they will go back to they will only remember the first language that they have learned.
So like
When they are still growing up. Yes.
like in severe dementia, they only remember their home language, like any kind of, they forget all the things.
Not all, but most of them. Yeah, the difference with the dementia, they can only remember the past, previous things, and they can no longer remember the present. What happened?
Like the certain thing is like deleted from their memory during dementia.
Yes.
Oh.
Okay, so most of them, they go back to the first language. They can only remember the first language that they have learned during the time that they are still growing up. And even though they already been in Australia for 30, 50, 60 years. Okay, it's hard for them to speak English. Okay, so for you to be able to communicate with them, at least you know a few words of their language. For example, if I will ask them, okay, good morning, I said, buongiorno. So when they heard buongiorno, they think that I am also Italian. Buongiorno, signora. It means good morning. Good morning, ma'am. Okay? Signora. Signor is Mr. So if you ask them to go to the dining room, come on, signora, it's already time for mangiare. When they heard mangiare, it's time to eat. So they will go to the dining room. And then if I put them to bed, buonanotte, it means good night. Or good evening. So you need to go to your bed because it's already nighttime. Okay, so it's learning a few words coming. You can gain a cooperation and trust coming from your resident. Okay, so when I have a resident a Japanese resident. Okay, they only speak Japanese. They don't even speak English when they reach the dementia stage. It so happened that I can speak Japanese. So most of the time I'm the one looking after the patient because I can understand her. I can speak a bit Japanese. Okay. So you can once they
How many language you can speak?
I speak my own language,
And English?
English
Yeah,
and Japanese.
Sri language.
Yeah,
that's good.
but not really fluent. But
I can understand.
But
like
you know
can
some
understand.
Italian words as well, right?
Italian is just a basic, It's good morning, it's time to eat,
Yeah,
good night.
that's enough.
Yeah. so that you can only
That's enough.
communicate with your
We
patient.
can like create a better interpersonal relationship with the client.
Yes. Okay. Learning their language,
In Italian.
it's as I have mentioned,
Ciao means hi.
you need to know the background of your patient
Salute means
before because they have
and senor.
some cultures that it's permitted to our culture, but for them it's not. Especially, like for example, if you are giving care for the Aboriginal people, for us when we are talking, maintaining the eye contact, it's necessary for us because that's the way we can assess the patient if the patient is telling the truth.
Yeah.
However, for those people, if you maintain your eye contact with them, they feel intimidated. It's for their culture, it's not allowed. Okay, so in my culture, you cannot call the person, come here. Instead, come. So for us, if you call the person, it's
Disrespect.
disrespect.
Yeah.
And in our culture, it's not allowed. Especially if you will call like this.
Yeah.
Okay, come.
Yeah.
It's like you are calling the dog in my culture.
Oh.
Okay. So instead of doing like this, come. Okay. So we have different cultures and culture and practices. So it's important for us to learn what is the background of our patient before we engage our care to them.
Sir,
Yes.
like one chart is enough to know about the client, but sometimes it would be not enough to us to make a good relation with the client. So we can do a history taking. So it will be more easier and convenient to have a good relation with the client.
Yes. For example, it's the first time that you will yes.
Sorry, I thought Brown was dead. Sorry, my bad.
Okay. So for example, this is your first time to face your client. So it is very important to read at least first page of their chart. The name of your client is very important. The background of your client is very important. And what is the complaint of your patient? So if you know those things, you can attended the handover. You know at least how to manage your client during your shift. Okay, and you can know more your client once you are having a constant encounter with them.
In Nepal, like we didn't keep, we don't keep any kind of personal like history about their background in our chart holder because in that we keep the TPR sheet, their complaints, etc. But the history is taken by one-to-one like interview. So
Yes, it's also fine. But if you are dealing with different a patient coming from different culture, it's necessary to learn and know their culture before you can give the good intervention to your patient. Okay? Next, understanding the physical needs of the client. Old age bring about a wide variety of problems during the old age. Physical, psychological function declines. Vision, hearing, smell, taste, and peripheral sensation. Okay? So, you need to be, or to extend more of your patient or patience when you are dealing with your patient or your resident. So, because especially if they are already in advanced dementia, as I have mentioned, they already lost their identity. They don't even know who are their relatives. Okay, they can only remember the names of their relatives. However, when the relatives is already there, they cannot remember their names.
And
Okay.
how did they know the words?
What's words?
Dementia means like losing the memory power, right?
Yes.
And then how do they speak languages? Like, how did they know what?
As I have mentioned a while ago, most of them can only remember the first language that they have learned during the time that they are still growing up. And even though they already been in Australia for 60 years, 70 years, once they become dementia, they forget to speak English. And they prefer to speak Italian or wherever they came from.
Home language.
Yes. For example, in the place where I work, most of our residents are Italian. They only speak Italian language. Even though you talk to them in English, they will respond Italian.
They will understand English.
They can understand, but they can respond Italian language sometimes. But there are times that they can no longer understand anything except Italian language. So what we did, we have an interpreter every day except Saturday and Sunday, so that we can convey what we want to tell to our resident, and if the resident will respond, the interpreter will tell us what the residents want. Okay. Vision, hearing, smell, taste, and peripheral sensation. As I have mentioned, okay, they can even smell that they already opened their bowel. They cannot even recognize that they are playing their poo, and they painted the poo in the wall. Okay, so if you cannot, or if you don't have, and if you can't understand them, you might end up of hurting them. Can you imagine when you are looking after them and then you already, especially at night, okay? Most of the residents are already asleep. And all of a sudden, one of your residents woke up, okay, and painting the poo on their bed. Okay? So, if you don't understand them, you might end up of hurting them. Okay? You might end up of restricting them.
Like abusing them.
Okay? Especially those residents who are wandering. So, you might end up of, what do you call this? Restraining the resident.
So we are like, sorry to
Yes.
interrupt. We are allowed to restrain the clients or not?
If there is a doctor's order, you can restrain, especially if the resident or the patient is prone to have fall.
Yeah.
Okay? But you need to take off the restraint after 4 hours. And then restrain again after 30 minutes. It depends the doctor's order. But with collaboration and consent coming from their relatives. Okay, so that before we do that, we need to have a case conference with the relatives, the patient, the doctors, and the nurses. So this is the situation of your parent now, or your mother. Your mother is really prone to have fall, and it's really hard to manage. So what we can do to prevent her from falling is to put them to restraint. Okay, and the family will sign that they agree on what we have discussed. Even though the resident is on the wheelchair, so we need to restrain them because they keep on standing, walking, and if they had a fall, then the life of the resident will more difficult, and it will start the deterioration of their health. Okay, so we restrain them, but with consent coming from the relatives. Okay, and there's a doctor's order that we need to follow. Okay, question. Okay, identify risks associated with the provision of support. Simple risks have simple solutions with problems easy to fix. Major risks involve potential injury to more than one person, and everyone's responsibility to identify and report. Please report as soon as possible all injuries, all near misses, all hazards, and all other incidents, including environmental, property damage, spills, etc. Okay, when one of your residents had a fall, make sure to make an incident report. What transpired during the time that you saw the patient? Okay, because we need to put the resident for monitoring. Okay, regardless of you are the one looking after the patient or you're not the one looking after the patient, we need to inform your supervisor what happened so that we can monitor that patient. There are some incidents happened that the nurse did not make any incident. She found out the resident on the floor. Because it's her negligence, she did not make an incident report. Okay, she just assisted the patient. There is no contusion, there is no bruises, and it's fine. Okay, then after 48 hours, the patient complained of headache. The patient was brought to the hospital. Before the patient reached to the hospital, the patient died. Then the doctors performed assessment. Okay, they found out that there is a hematoma on the back of their head, and they know that it caused by. They know that the resident had a fall, but it was not documented. Okay, so it's the nursing home responsibility, and if the relatives file a case against the nursing home, they can claim a huge amount, and there's a possibility that the nursing home will be closed. Okay, regardless of what happened. Okay, and if you saw your resident had a fall, and you find the resident on the floor, you need to call your supervisor and inform her that you find the resident on the floor, and your supervisor will be the one to assess and make an incident report, and you will also be the one to.
Good morning, sir.
Excuse me, sir.
So like we can't, if we see our client in a ground and we can't like support him or like assist them.
if you will be working as an assistant in nursing, you are not allowed. Only the registered nurse who will do the assessment, and she will be the one to do the incident report.
That means
Okay, after the assessment of the registered nurse, then it's time for you to assess the patient and lift the patient and put the patient back to their bed.
that means as soon as the incidents happens or we saw that, we should inform
Yes.
senior supervisor
Yes.
or RN.
Yes. Because she will be the one to make an incident report. That is why it's if you are working in the floor as an RN, they keep on telling the assistant in nursing, please, there should not be a fall today, because they will give them a hard time to make a documentation. Okay? And the resident will be placed for monitoring. Every 30 minutes, you need to monitor the OBS. You need to monitor the pulse rate. You need to monitor the blood pressure of your patient. OBS is like the pulse, what do you call this?
SPO2?
SpO2.
Okay.
Yeah. We just inserted it in the finger, and then we need to count the. Okay. Next. So identifying risk is the responsibility of every staff. Okay. Do not wait until the resident had an accident. Okay. If you've seen the water spill on the floor in the corridor, then find the signage and ask the janitor to mop it and dry the area. Okay. Take account to identified risk in the provision of personal support. Situation of risk. The main situation of risk include evidence of self-neglect, behaviors of concern, impaired judgment and problem-solving abilities, impaired cognitive functioning, sudden and unexpected changes in health status, and home environment hazard. Okay, evidence of self-neglect or behavior concern. Okay, those are the main situation of risk. Okay, questions regarding this one? Okay, encouraging client to participate in their personal needs. It is important that the clients are encouraged to take an active role in completing their personal care needs. The objective is to assist your client to maintain or improve their independence. This can enhance their ability to participate in the community, helps the client to recognize their level of skills and capabilities, and help to build up their self-esteem levels. So, the recreational officer will be the one to organize the activity for all the residents. Okay, for example, today they will organize an activity for those residents who can still mobilize themselves. Then they bring all the residents to the park. Okay, and some other activities also organized to some residents who can no longer walk, so that they can be more active, and as a nurse, we encourage them to participate, even in giving the nursing care. Okay, as I have mentioned, when you are giving the shower to your resident, you need to ask them which clothes do you want to wear. You want to wear this or you want to wear this. Well, in that sense, you are giving the resident or the patient a chance to choose what is the best for them. Okay.
Excuse me, sir, like
Yeah.
While caring the client, if they told like we want to do our work ourselves, then we can allow
Yes.
them?
If your client can still manage,
Okay.
then you allow it to do it for them. But you need to be there to assist them.
Under supervision of ours?
Yes. Okay? Provide the person with information to assist them in meeting their own personal support needs. One of the ways support workers can help clients to remain independent is by ensuring clients are well informed. There is a range of different types of information that clients may need, like. Okay? As I have mentioned, you always explain to your patient or to your client what are you going to do to them. Okay? So you explaining the procedures is very important so that you can gain a cooperation coming from them. Information about aids and equipment, information about processes, information about other services, and knowing your job role. Okay, when you enter to the room, and then you always introduce your name and tell them who you are and what are you going to do to them. Okay, so in that sense, you are giving the time to your patient to think and what do you call this? To think and ready, becomes ready emotionally, psychologically. Okay. Providing care with technical care activities include technical care activities are tasks that require the use of specialized medical or technical equipment or aids. Includes measuring blood pressure and glucose level, measuring temperature, pulse, and respiration, caring for simple wounds, and gastrostomy feeding.
So gastrostomy feeding means NG feeding?
Yeah. And
NG tube feeding? Like tube with insert and we insert the liquid for
sometimes nasogastric tube is inserted to their nose, going to their stomach. Okay, some of them is solely directed to their stomach, and you just need to place the osteorized feeding so that they can still nourish. Okay. Those patients who can no longer swallow, then nasogastric tube inserted, or what's called this?
gastrostomy feeding.
Yeah, gastrostomy feeding. Next, providing care with technical care activities, catheter
Catheter care.
So once they already, catheter is inserted for those patients who are having difficulty of urination. Okay? If their kidney is no longer functioning, or if they have difficulty on urinating, then the catheter must be inserted. And the nurse needs to care the catheter, what do you call this? The genital, okay, to prevent from having an infection. Or from the time the RN needs to take out the catheter and replace for a new one.
So we are not allowed to even take out the catheter?
No. Only the
catheter care?
only the RN.
Okay.
Yeah. But that's the law here in Australia. So we need to follow.
Like we have to do only catheter care, that's all. No
Yes.
insertion, no.
No. No removal of catheter, no insertion. Yeah. But if you get your license as an RN, then you can do it. Application of prosthesis using antithrombotic stockings, assistance with breathing devices, and simple eye care. Okay? Yung antithrombotic stocking, I already explained it last time. Okay?
To Windsor, to nurse.
How to report changes? Changes must be documented and reported there are a number of different ways to report changes. By telephone, quick and convenient way, face-to-face, written report, progress notes, or case notes kept in the client's live incident report is a form that is filled out if there has been an incident or event happen. Okay, question?
No, sir.
Okay, next is maintain confidentiality, privacy, and dignity of the person. As a healthcare worker, you are obliged to maintain the confidentiality, privacy, and dignity of your clients. Confidentiality is a legal requirement that means access to a client personal information is restricted to authorized people only. Okay? So whatever information you gather coming from your patients, okay, you need to keep it to yourself and to those people who are involved and giving care to that specific patient. It should not be discussed in the public places. Okay, example, elevator, in the cafeteria, and even to your house. Okay, so there are one incident when I'm still in the Philippines that two of our students talking about their patient inside the elevator. Okay, and it so happened that the wife of the patient is a doctor. They don't know that the wife is on their back. That patient is a sailor. You know sailor?
Yeah.
Work as is a ship. Okay?
Oh, yeah.
And then when they came back to Philippines, he already positive for HIV. Okay? And the wife brought the husband in the hospital and straight away to the ICU because he's already deteriorating. And two of my students are looking after the patient. And then they keep on talking. I don't want to be near to the patient. I'm scared because I might be having the HIV later on. Okay, and the wife was on their back, just listening.
Yeah.
And then after the two students get off the elevator, the wife went straight away to the medical director. And she reported the two students. Okay? It's a big issue to our university because the confidentiality of the patient has been violated and exposed to the public place. Okay? And when the wife coming after the wife went to the medical director, he came into ICU. And that's the students only realized that she is the wife of the patient. And afterwards, the two students was called up to the medical director's office, and they were not suspended. They were expelled to the university.
From the university.
Yes.
Because like I think the hospital have
With the-
in our country the
Yeah,
hospital don't have that
we do.
authority to expel any student from their college or university. It's the only college or university they can do that. If they have done any mistake, instead of expelling them, the hospital just don't allow to do practical in the hospital. Like if any college or university has done mistake, they don't allow that particular college to be on that hospital.
Yes. In our case, the students are already been informed. They already have their fundamental skills and theory that whatever that you need to respect the privacy of your patient. The data that you can get coming from your patient must not be discussed in the public places. Okay. And then it so happened that they are not, I think they are not listening they don't bother the importance of having the confidentiality matter that they were able to discuss it inside the elevator. So the hospital, or otherwise, we can no longer affiliate. And what will happen to the hundreds of students who will do the practicum in that hospital? So instead of compromising the whole university, the deans expel the 2 students.
In Nepal, the
They can still pursue their nursing program, but in other university.
in Nepal, the whole college is expelled.
Yeah.
In our group, like we used to do in government hospital. One of our like colleague college has done mistakes, and the whole college were expelled. They were not allowed it that to perform on that particular hospital because they had done mistakes. Like I don't know what was exactly. It was like big issue, and they all were expelled. Like that particular college students will never be on that hospital, and they are not allowed to do any practical work on that.
Yeah. In our university, only the 2 students, because they are only the one who made mistake. And all the university, they put the whole university in the limelight because it's a big issue.
Yeah.
Okay. So questions with regards to confidentiality and privacy? Okay, next, maintain confidentiality, privacy, and dignity of the person. Protecting a client confidentiality and privacy means making sure personal information not to be shared. Okay? Means ensuring that clients are not able to be observed when receiving personal care from anyone other than the workers that are providing the support. As I have mentioned, you can only share those information with those team who are engaged to that patient. Okay? How information should be documented? Conform with legal, professional, and organization requirements, concise and accurate, up-to-date and meaningful, internally consistent. The purpose of accurate record keeping is to maintain accurate information, to respond to client needs, and to provide effective and quality services, and to demonstrate accountability to service users, funding bodies, government, and other agencies. Question?
No, sir.
Okay. Complete and maintain documentation. We should be aware of and abide by legislative requirement, policy requirements, and any organizational protocols about how documentation and reports are completed, maintained, and stored. So for every organization, like for example, in hospital, there's always a place where you can find the chart of the patient. Okay? It's not being placed anywhere, but there's a special place that you can only find the chart of your patient. So in my country, when the doctors do the rounds, the nurses is the one handling those charts.
Yeah.
But in Australia, if the doctors want to see their patient, doctor, this is the chart of your patient. The doctor will go there to see the patient. Okay?
By
And
himself?
yes.
This is
Okay? In my country, all the charts is the nurses was the one bringing all the charts.
because if they
If the doctor has 10 patients,
Yeah.
all the
10
10
charts,
charts
yeah.
will be carried by the nurse.
and we have to write the all information.
Yes, you are
The
writing all the
doctors as well.
information based on what the doctors ordered.
Yeah.
But here, if you want to see your patient, doctor, here is the chart. Go.
Yeah, it will be more easy for nurses as well because
Yes.
the chart is so heavy. Like we have to carry not only 10, there are altogether 30 patients. We have to carry all 30 charts by 2-3 nurses and give doctor this, doctor
Like they will order USD form.
give this, and we have to
Yeah.
doctor.
So that's the difference here in Australia.
It's
If-
good for nurses.
It's good for the nurses. Okay? We're not looking like a helper of the doctor.
Yeah.
The- a secretary of the doctor that keep on writing what the doctor is telling to us.
The one only, the
Here, doctor, here is your chart. Here is the chart of your patient. And then the doctor will go there by himself.
Yeah, it's good. But like it's a bit bad also because we will miss some information regarding what the patient say.
No,
We
but
have to see
if-
all the charts.
Only the doctors will ask if if he or she needs to discuss some nursing care to the patient. And then that's the only thing that you will come. That the doctor will tell you, okay, can you come with me? We have some discussion with the patient. Because the doctors also need to inform the patient on what the nurses needs to do to them. Okay? The doctors need to explain to the patient what the nurses needs to do to the patient. Sometimes the nurses are there, but most of the time, only the doctors will be the one to do the doctor's order. They will be the one to write, not the nurses.
So like in aged care room, there are physicians?
Yeah.
Or like
There's
specialized doctor as well.
some of them are gerontology doctors, some of them are general practitioners. Next, recording and documenting work is ongoing task. Many actions that are recorded happen repeatedly but must be recorded each time. Okay. Filing document appropriately, records must be stored in the correct place so they can be easily located and referred to when required. Okay. Storing the information. Information should always be kept in a safe and secure area. Hard copies, files in a lockable cabinet with files stored alphabetically by surname. Electronic filing system uses a password encryption instead of key and a lock to protect the information. Okay. So sometimes we've been busy in the ward. Okay, if we are storing the information in the computer, that before leaving the computer, then you need to exit, because you will be given your password, your own password. Okay, it's better to exit before leaving the computer so that no one can see what have you written in the patient chart. Okay, question?
No, sir.
No question?
No, sir.
Okay. Are you sure?
Yes, sir.
Excuse me, sir, it's like 10:11. We can take our coffee break.
Yeah.
Thank you.